Thank you. So do you. You look so young. Hey, everybody, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Today's guest, I actually saw at a summit that was hosted by Dr. Judy Brangman called the Reclaim Your Health Summit. And she's been on my radar ever since. And thankfully, Dr. Brangman gave me all the email addresses of all the wonderful speakers who pretty much have been invited to be on this show. And you'll be seeing many of them upcoming in case you're not familiar with them. And you need to be familiar with them because they are doing great things in the world. And Dr. Brangman herself will be on the show. She had to postpone it. She actually had car trouble, so she's going to come on really soon. But today's guest comes from Virginia Beach, Virginia, and her name is Dr. Lynnette Moore. It's so nice to officially meet you.
Thank you, Chef AJ. It's an honor to be here on the show with you.
Yeah, well, I really enjoyed your presentation on the Reclaim Your Health Summit because you said something so profound. It was something like the time to prepare for battle is before you go into battle.
Yes.
And that just is so profound, especially with COVID, because, people are really trying to, not everybody, but a lot of people are trying to reclaim their health because of this pandemic when the time to do it would have been ideally before.
Exactly. Yes, I really enjoyed my time on the Reclaim Your Health Summit, and where I spoke about optimizing the immune system. And again, the time to prepare for war is beforehand. And so using, nutritional principles, lifestyle principles, if we could prepare and fortify our bodies in advance, then that is the optimal scenario in case we are faced with items that can affect our health adversely.
Right. And another thing you said, because see, I'm a big fan of acronyms. I think that's how I remember everything. I remember, I forget what class it was in college. I think it was to memorize all the nerves. We said on Old Olympics, towering tops, a fin in German brewed some hops, and you take the first letter, or to remember what the formula for pi was. They taught us, may I have a large container of coffee, please? And you count the things. So I love acronyms. And you had a great one. You said you tell your patients to follow the rainbow. And I always think of my favorite song, Over the Rainbow. So what does that mean to follow the rainbow?
Actually, I include that in the PowerPoint that we're going to discuss today. But the rainbow, the acronym stands for rest, activity, ingest, nature, believe, overcome, and water. And I will get into more detail as we go through the presentation.
Well, I can't wait. Did you want to start the presentation right now? And then maybe our viewers could ask questions afterwards.
Yes. Okay. And I may stop maybe midway, see if there's any questions with the PowerPoint.
Sounds good. Thank you. Because I'd love to hear your story if it's not in the PowerPoint, like how you got into plant-based nutrition in the first place.
Yes. Okay. All righty. So let's open this up. Oh, actually, I should have shared first.
Yeah.
Wait a minute. Let me go back and hit share screen.
Yeah, that always helps the viewers see better.
And here we go. Can you see that, Chef AJ?
I can't. I really can't see anything.
You can't? Okay. All righty. Let's do this again here.
That's okay, because it's giving me time to put everything in the show notes because.
Oh, okay.
Yeah, it doesn't. I mean, it doesn't. I don't mind from my end. So yeah.
I need to hit the share button.
That would be a good idea. We should have probably practiced it before, huh?
Okay. Let's try this again. Oh, it logged off. Hello, Chef AJ?
Yeah.
Okay.
I can see you and hear you. Let's see if there's an advanced sharing option that I could do.
Okay.
Yeah, I have everything that everybody you can share.
And,
that'll be something.
And I cannot see you.
You can't see me. You want to try logging in and out, and I'll entertain the troops?
Okay, yes, please.
Okay.
Alrighty.
Guys,
okay.
Yeah, absolutely.
Okay, thank you.
Sure. Guys, hang on. We have due to a technical difficulty, I will be entertaining you for a minute. And one way I'll entertain you is to remind you to please sign up for the Truth About Weight Loss Summit that will air live for 5 hours a day from February 13th to February 21st. We begin every day at 8 a.m. Pacific time. We're going to kick the day off with Dr. Joel Furman. I'm actually going to end the summit with him too. He actually decided to do two times. You love my hat, Gina. Thank you. It's one of those days where I didn't quite have time to take a shower. So yeah, I like it because it's got my initials on it. So yeah. Oh, look, it's working.
Okay.
Yay.
All righty.
Right. Oh, but you know what? If you wouldn't mind putting it in a different view, because we're seeing the left hand of the slides too, maybe in a slideshow mode.
Yes, I am about to hit from the beginning.
Perfect.
Perfect. All righty. And I'm going to remove my controls here. Okay. So our presentation today is what you need to know about diabetes from A to Z and how to reverse it naturally too. I do want to put a little disclaimer out there that this information is just for general education and I am not diagnosing or treating, and please seek advice from your medical provider before making any major lifestyle or medication changes. Always nice to have that disclaimer. And a little bit about me. I am board certified in family medicine, internal medicine, and as of a year ago, I decided to seek certification in obesity medicine. I'm also a plant-based holistic health coach, and my passion is educating on nutrition, lifestyle, and I offer lifestyle makeovers and actually kitchen makeovers along with some cooking classes. And all these, of course, are virtual in the midst of this pandemic. And the ultimate goal is to have optimal health and reversing disease, illness where necessary. And another information about me is that I love butterflies, rainbows, and the color purple.
It's my favorite color.
Oh, it is?
Yep.
Oh, awesome. Okay. And I'm also married, and I have one daughter who is currently in law school, virtual style. All righty. So look at this. I love rainbows. What can I say? I just had to put a picture in here. And when you look at a rainbow, especially after a rainfall and you see it in the sky, it just captivates us. It captivates me, and I'm just inspired with hope when I see the rainbow. So again, we'll talk more about the rainbow throughout this presentation, but that's just so beautiful there. Next, there. That is me in 2003.
Wow.
Yeah, that's me in 2003. And one of the reasons I wanted to do this presentation, Reversing the Diabetes from A to Z, is, well, back in 2003, I was a physician for, quite a few years at that time. And I just came to a health crisis where I was approaching, in a few years, I was in my 30s, I would be 40 in a few years. And I just thought, I'm like, as I look at the patients that I have been caring for, many of them with chronic diseases, including diabetes, and I saw the complications that they were having, the tragic, outcomes, and I was said to myself, Lynette, you don't want to be like that. You don't want to have those conditions unnecessarily. But yet I had all this weight on that I've had for years. I was always out of the four children, I was the one that was always the heaviest. But at this was my sort of my peak weight. My body mass index was about 44, at that time, and I just felt out of control. I didn't know what to do. I didn't have any self-control, and so again, I decided to do this presentation for diabetes because I realized I was at risk for not only that, but also hypertension and many other conditions. And Chef AJ, would you believe at this time, I'm a vegetarian at this time. I was a junk food vegetarian. All I
I think
did was take away meat when I became a vegetarian 10 years earlier. So all I did was remove meat, but yet I had all the cheeses and everything. I didn't eat a lot of fruits and vegetables. But again, this was the beginning of my health journey. But let's go on to diabetes, one of the feared conditions that I was potentially facing. So, what is diabetes before we get to the A? Diabetes is characterized by elevated blood glucose levels, either because the body does not produce adequate insulin, which would be type 1, or it does not properly utilize that insulin that is produced. And diabetes, if uncontrolled, may lead to complications, premature disability, and death. And again, that is something I did not want to face and hopefully prevent, if at all possible. What is the magnitude of diabetes? There are 34 million diabetics in the United States. 7 million of them don't even know it. It's the seventh leading cause of death in the US. And that might have changed because of the COVID, since COVID, I think, moved into number one. But prior statistics was that it was seventh leading cause of death. Now, in addition to diabetes, there's the pre-diabetes, the stage before diabetes. There are 88 million Americans with pre-diabetes. So just think in how many years or decades will there be 88 million persons with diabetes if we don't take steps to reverse it? That is staggering. The cost of healthcare is already astronomical. Just imagine if this comes to fruition, all of these additional diabetics. Another unfortunate thing is 9 out of 10 pre-diabetics are not even aware that they have it. So since I'm on here, I'm going to just advise you to make sure you go to your doctor or whoever your healthcare provider is and get your routine health maintenance exams with the lab work. Okay, let's move on to A. So when I have a new person coming to my office who has a history of diabetes, I ask them, well, what's your A1C? Some know, some don't. And it's unfortunate when those who've had diabetes for several years, they do not know what their A1C is. And what is the A1C, you may ask, Dr. Lynette? And I'm called Dr. Lynette on social media. I consider the A1C as the diabetics report card score. It's also known as the hemoglobin A1C. And what this reflects is a person's average glucose over the past 2 to 3 months. The more glucose that is in the blood, the more it attaches to those red blood cells, to that hemoglobin, hence the hemoglobin A1C. So what are the normal levels? A person without diabetes or prediabetes, the number is from 4 to 5.6. Prediabetes is 5.7 to 6.4, and diabetes is 6.5%. So the goal for most diabetics is to get below 7, sometimes even 6.5. And for those who are really doing intensive lifestyle modification, I've seen completely reverse it and they go back down to the normal range, 5. So you may say, well, what does these numbers correlate to? And let me get my arrow. Here we go. So for example, if someone has a hemoglobin A1C of 10, then their average daily glucose is about 240. Get my little arrow here, right there. Now, you certainly don't want your glucose hanging out at 240 on a daily basis, because it damages your body, the lining of your blood vessels, your nerves. The highest A1C I think I've seen was probably 15 or 16. And the highest glucose level I've ever seen was 1200, and they were walking around just fine. And whoops, let's reverse that. Okay, but again, the goal is to get closer to normal. So that is the A1C. Now on to B. Since we have to get to Z, got to move quickly. Alrighty. Oh, and the A1C should be checked at least 2 to 4 times a year for those with diabetes and even with prediabetes. Okay, B. Alrighty, B is blood pressure control. Do you know what your blood pressure is?
Yes, today. Yes, I actually do. I was at the doctor today. It was it was 88 over 54.
Wow. Now that is a good blood pressure, great blood pressure. Now, for some people, that number, Chef AJ, might be too low and they may feel dizzy and lightheaded. So the important thing is to find out what is the optimal blood pressure for you, each person. And so, but that's one. Is that your normal blood pressure in the 80s?
Yes. You know, I exercise a lot. I don't eat salt. I've been vegan for almost 44 years.
Okay. Awesome. So excellent blood pressure. 1 out of 3 persons in adults have hypertension. Elevated blood pressure leads to heart attacks, strokes, heart failure, kidney disease, dialysis. What is the blood pressure? The top number reflects the pressure in the blood vessels when the heart beats. The bottom number, the diastolic, is the pressure in your blood vessels when your heart is relaxed. How do we help improve blood pressure, reverse it? Rest, activity, ingest, a rainbow of foods, stress control, water. Try to avoid those things that can raise blood pressure, such as alcohol, excess sodium, even coffee can raise blood pressure, and cheeses. Now, going back to my picture, I loved cheese, and cheese is loaded with sodium. But the good thing is there are plant alternatives to cheese, and you can make some homemade, or if you needed to purchase some, you could also. Another important thing is if you are prescribed medication, please take it as prescribed, because it's unfortunate if you're not taking it and your doctor thinks you're taking it and you go into the office and your blood pressure is uncontrolled and they're just going to increase the dose. Just be honest with your healthcare provider if you have not been taking the medication, and then have a discussion on why you're not taking it. If you say, hey doc, I don't want to be on medications, I want to try to work on my diet and my lifestyle, then get some guidance with that, and see if those numbers do decrease with your lifestyle modification. But if they do not, if your blood pressure is consistently elevated, 180 over 110s or what have you, your blood pressure needs to get down one way or the other, because you do not want to have a stroke while you are waiting for your lifestyle measures to begin to work. The target for most diabetics is less than 130/80. Less is better, but again, that's the general target, and it is individualized for different persons. Okay, body mass index is another B here. 85% of diabetics are overweight. So again, I had something in common with diabetics, and so trying to decrease that body mass index was critical. So what is BMI? Do you know your BMI? BMI is a measure of body fat based on your height and your weight. It's an indirect measure. And what are the normal? The normal is between 18.5 and 24.9. Overweight is 25 to 29.9. And obese, the obese category is 30. Extreme obesity is over 40 or above, or at least 100 pounds overweight. And that picture, I was in the extreme obese category because my BMI was 44 at that time. You can find your BMI. You can just Google it, put in BMI calculator and plug in your numbers, and you'll find out what your BMI is. There are some limitations. For example, athletes who are very muscular, that chart is not a good reflection of body fat because muscle does weigh more than fat. And so they may have a higher BMI, but it's not due to fat, it's due to muscle. And while we're here on this, I did want to give a definition of obesity. Now, there was a time that, when they said that obesity was a disease, and this was like a few years ago when they said it was a disease. I was thinking, oh, it's not a disease. I'm like, why are they saying it's a disease? But after going through my training for obesity certification, I could appreciate more why it was called a disease. And the official definition is here: a chronic, relapsing, multifactorial neurobehavioral disease wherein an increase in body fat promotes adipose tissue dysfunction and abnormal fat mass physical forces, resulting in adverse metabolic, biochemical, and psychosocial health consequences. And after, breaking this all down in the midst of my training, I said, yeah, it is a disease. It's, what is this adipose tissue dysfunction? It turns out that adipose tissue is like an organ on its own, and it starts to take a life of its own when the levels exceed the normal recommended levels. And also too, the physical mass forces include like the arthritic issues that you can get. And then the psychosocial health consequences can be, depression, etc. So I just wanted to share what this definition of obesity, the official definition of obesity, is. Okay, let's go on to see, do you know your cholesterol? Cholesterol is a waxy fat-like substance found in foods and animal products, but also we produce it. Our liver produces cholesterol. So the good thing is you don't need to eat cholesterol. So anything with a face or a mother is not necessary because your body makes enough as long as your liver is healthy. What is cholesterol used for? It actually is used in the cell walls to maintain the cellular integrity. It's also used to make hormones, also like bile acids. The important thing about cholesterol, if it's too elevated, it can clog up those arteries and the small vessels. So you want to make sure you know what your levels are. And the only way you can do that is get blood work done. So please make sure you are aware of your cholesterol levels. But we typically say 200 is the cutoff, for starting to be elevated. But I say that if you're able to get that total cholesterol down to even closer to 150, that would be optimal. And hey, I just wanted to share, since you shared your blood pressure, Chef AJ, I want to share my last lipid panel.
Okay.
All righty. And I am on a total plant-based diet. So this was from August. My total cholesterol was 152. My triglycerides were 77. My HDL was 49. That one has always been on a sort of a low side. For women, we like it to be above 50, but hey, I'll take 49. And my LDL was 87. And so for LDL, we like to have that ideally below 100. So I am pleased with my cholesterol profile. So please get your cholesterol checked. Now on to D. How do we diagnose this diabetes? Getting a fasting lab work, your glucose, if it's 126 or above, typically we say on 2 occasions, 2 separate days, then that's the diagnosis of diabetes. We talked about the A1C, 6.5%. But the interesting thing is the hemoglobin A1C does not capture all cases of insulin resistance diabetes that we'll talk about, which we will talk about in a little bit. And a test that can bring out um, cases of diabetes that are not discovered by A1C or even the fasting plasma glucose is the oral glucose tolerance test, where your glucose is checked before you drink a sugar-laden beverage, and then 2 hours later, your glucose levels are checked. If your glucose level is 200 or above, you have diabetes. Normal is 140 or less. Alrighty. Another D is please get to the dentist. Excuse me. Diabetics have increased risk of gum and tooth loss. And the depression, persons with diabetes are at increased risk of having depression and even vice versa. You may experience some sadness, hopelessness, loss of interest in normal activities, and possibly it could be because of the comprehensive nature that diabetes can just take over your life, the constant monitoring, the potential side effects, so that could be a contributing factor to the onset of depression. Lifestyle measures to help reverse it is making sure getting rest, activity, eating healthy diet. Believe it or not, foods can trigger, depression, unhealthy foods, and there are foods that help boost the mood. Getting sunlight. Hey, when you go outside and you see that sun, that typically perks you up. And seek professional help if necessary. And I do want to say this to um, the audience, Chef AJ, that if anyone is at the point of severe depression, that they feel that they may hurt themselves or they're not safe with themselves, to please seek immediate help. Please seek immediate help, because we don't want anything to happen to you. All right, let's go on to E, endocrinologist. That is a physician who has been trained in diabetes and other hormonal conditions. Should you go to one, if your diabetes is out of control, your primary care doctor has, tried several medications, if necessary, and if you are compliant with your lifestyle, physical activity, doing everything that you know how, if your diabetes just continues to get out of control, if you're on insulin and your insulin dosages just keep being increased and increased and increased, then I would say yes, please ask to see an endocrinologist if you are not recommended to see one by your provider. And one of the most important E's here is exercise is medicine. Now, you've heard that over and over again, but truly it is medicine. It increases glucose uptake into the cells. And I particularly recommend that you walk about 20, 30 minutes after you eat to help facilitate glucose uptake to lower those glucose peaks. And the recommended goal for most people is about 30 minutes, 5 times a week, about 150 minutes per week of moderate activity. And please include some strength training. I have my weights here, got my purple weights, and stretching and balance. And for persons who have been sedentary, you may want to consult your healthcare provider before embarking on a strenuous exercise program. So F is foot care. Uncontrolled diabetes can lead to foot and leg amputations. Please inspect your feet on a daily basis. I know of several cases that a person with diabetes with neuropathy has had a nail in their foot and didn't know that they had a nail in their foot because they hadn't looked at the bottom of their foot. So please check your feet daily. Get to the podiatrist for foot care and monitoring of any neuropathy, and please make sure your shoes are well fitting. Fiber, another F here. Fiber is a type of carbohydrate in plants that the body doesn't digest. It just stays in your gut. It fills you up, makes you full, but it does not fill you out. It does not contribute to weight gain. It helps improve insulin resistance and cholesterol. It helps soak up those excess fats that you may eat um, with your meals. Fiber also helps feed the good bacteria in your gut. So you want to make sure that you have adequate fiber. And where is fiber found? Only in plant foods. Ideal foods would be like oatmeal, beans, Brussels sprouts, flaxseed. How much should you have? Now, the typical SAD diet, standard American diet, has about maybe 10 to 15, and 15 is probably generous, um, grams per day. But I would aim for about 35 to 40 grams of fiber a day, but increase it slowly. And as you increase, please make sure you are increasing your water, because as it expands, you want to make sure that that fiber is moving through your colon to help with bowel regularity. G, okay, we are moving along. So G here, this is the star of diabetes, glucose. So carbohydrates, all carbohydrates break down into glucose and is the preferred fuel for the body. It is stored in the liver and it is released when the body needs energy. So, you've heard about simple and complex carbs. So just a simple explanation of the simple carb is that a simple carb is made of 1 to 2 glucose molecules, and examples are fructose, sucrose, the high fructose corn syrup, the sugars that are found in cakes and cookies. And when you eat these products, you get a quick rise in sugar levels, your insulin levels shoot up, and that's not healthy for a person with diabetes. A complex carbohydrate has a longer chain of glucose molecules, and those are broken down slowly. Hence, your glucose levels rise slower, and they also have fiber with them, and that's why complex carbs is what's recommended more so over the simple carbs. And so examples are the fruits, veggies, beans, whole grains, and nuts. Okay, and this here, I like this graphic here of glycemic index. You may have heard about glycemic index. And what that is, it ranks foods by how slowly or how quickly they raise blood glucose. And the range is from 0 to 100, with 100 being glucose. And so persons with diabetes should aim for levels of 55 or below. The lower, the better. It's not to say that you can't have any that are in that higher group, but if you do it very sparingly and small quantities. So in the 70-100 group, you have your refined products like your crackers, um, white rice. It even has watermelon in there. Not that you can't have watermelon, but just use it, judiciously. Um, Down in let's see, the 30 to 50 group here, you have your oatmeal, you have beans. Down, I like the 0 to 10 group. That has the broccoli and the cabbages there, chickpeas. So the glycemic index is is very, very low. So those would be products that I would recommend that you look for and begin to experiment with when you're cooking foods, and get a cookbook aimed towards diabetics that can help you incorporate these healthy foods into your diet. Okay, let's move on to H. Alrighty, heart. Now it is February, and this is Love Month and Heart Awareness Month. So please protect your heart by making heart healthy choices, and that includes taking care of your diabetes. Cardiovascular disease, unfortunately, is the #1 cause of death in persons with diabetes. And the risk for death from heart disease is 2 to 4 times higher in persons with diabetes. It's very unfortunate. But it is important for you to recognize potential signs of heart attack, heart disease, chest pain, sweating, um, discomfort in the jaw, radiating down your arm. Those are like the classic ones. But persons with diabetes, if their diabetes is uncontrolled and they've sustained nerve damage, they may not feel anything at all until they just have a sudden collapse, a sudden cardiac event. So again, hence, the goal is to try to have optimal glycemic control and improve that A1C and get those numbers down. And of course, if you're suspecting possible heart, please don't hesitate to call 911. It's better to be evaluated and told that it's not your heart than to it be your heart and not be evaluated and you passed away. Next, we have hyperglycemia and hypoglycemia. And just quickly, hyperglycemia is elevated blood sugar. You only know if your blood sugar is elevated if you check it, so please make sure you monitor it. You may have excessive thirst, hunger, or urination. Please make sure you hydrate yourself. Take your medications if you are on medications. If you have a sliding scale given by your healthcare provider, please take that and notify your healthcare provider if not improved. And if your levels are very high, then please contact your health provider or go to the emergency room if necessary. Hypoglycemia, this one tends to happen more quicker, where your sugar is low. You may get sweaty, confused. Some persons may get seizures. If you, at the first sign of hypoglycemia, which typically may occur below 70, please treat it promptly. Drink some juice. If you have a piece of candy or a glucose tablet, please take it. And if a person is subject to having repeated attacks of hypoglycemia, they may want to ask their provider to have a glucagon injection available for their family members to administer to them. And glucagon injection will help release the glucose that's stored in the liver. And once that injection is given, a person who's unresponsive typically would wake up in about 15 minutes. And of course, if the glucagon is necessary to be given, or if someone is hypoglycemic, very low, I would call 911, seek immediate medical care. Are there any questions at this point, Chef AJ?
Well, there was one question from someone who said that they actually had normal cholesterol and blood pressure and still had a heart attack.
There's various causes for heart attack. Sometimes it could be, stress. Hopefully that person, they had an evaluation to see if they could determine what the cause was. Because, you said he has normal blood pressure, normal cholesterol. Did they have diabetes?
Maybe I don't know. So maybe you can.
Okay. So there are other causes for heart attack besides just elevated cholesterol and blood pressure. Okay, let's go on to hearing loss. Hearing loss is twice as common in persons with diabetes. So if you're having problems hearing and you don't have excess wax in your ear canal and you have diabetes, I would get to the audiologist to have a hearing test, or the ENT specialist. Infections. Persons with diabetes are in a state of they're relatively immunocompromised. The glucose affects the ability of the white blood cells to do their job, among things. So infection should be treated promptly. Of course, aiming for glycemic control is critical. They get the dental infections, increased risk of pneumonias, ear infections. Any infection you can think of can be increased in persons with diabetes. So please treat them promptly. please have it treated promptly. And then also too, immunizations are recommended, like pneumonia, vaccines, tetanus, just the basic immunizations recommended to help minimize infection risks. Now let's move on to the insulin. The insulin is the hormone that is produced by the pancreas, and it acts like a key, unlocking those receptors on the cells so that glucose can go inside the cell. If the glucose cannot get inside the cell, then the cell cannot do its work, cannot get the energy that it needs. Insulin also promotes storage of glucose in fat, muscle, and the liver cells. What's not used for energy is stored, is converted to fat for long-term storage. Type 1 diabetics, that's just 5% of all diabetics. They make little or no insulin and require insulin to live. Type 2 diabetics comprise 90 to 95% of all diabetics. And they make insulin, but due to insulin resistance, it's not enough, and that insulin is not used effectively to control glucose levels. And we'll learn more about insulin resistance here. So the cells in the muscles, fat, and liver respond poorly to the insulin, and the glucose that's in the blood cannot be used. And so to compensate for this, the pancreas begins to make more insulin, because the cells are saying, we need energy. So that insulin just keeps producing, and the blood sugar levels just keep increasing because the body is in a sort of an instance of starvation. And a major contributor to this insulin resistance is increased body weight, especially abdominal obesity, and having a high fat diet. Just imagine having high levels of blood and cholesterol, high levels of fat, lipids, and cholesterol in your blood, having thick, sticky blood. Imagine your cells and hormones and all those things trying to work in an environment such as that. Have some difficulty. How do we improve this insulin resistance? Losing weight, exercise. And insulin levels are typically not measured in a primary care practice. They can be, but a high insulin level can be a marker that someone is having insulin resistance before they even have a diagnosis of diabetes. So that's one test you may want to ask your provider to get for you. Now, insulin resistance and metabolic syndrome are closely related, and a person with metabolic syndrome typically has 3 or more criteria of these following traits. Increased waist size, 40 or above for men, 35 or more for women, blood pressure of 130/85, fasting glucose of over 100, fasting triglycerides, which is a fatty substance in our diets, over 150, and a low HDL, less than 40 for men and less than 50 for women. So if you have 3 or more of these, then you meet the criteria for metabolic syndrome. And again, metabolic syndrome and insulin resistance are closely tied together. Some physical exam indicators that you may have insulin resistance could be having multiple skin tags around the neck or in the armpits area, or having patches of dark velvety skin, for example, behind your neck. And that's called acanthosis nigricans. So if you have those, you may want, and you haven't had blood work, then you may want to get to your healthcare provider. Now, I like this J here, and joy. Definition of joy here: a feeling of pleasure or happiness that comes from success, good fortune, or a sense of well-being, something that gives pleasure or happiness. Do you have joy? How you feel, how you think impacts your health. And joy can help boost your immune system, fight chronic stress, just overall gives a sense of well-being, promotes a healthier lifestyle. And would you believe that the joy uh, is felt because of our brain chemicals, particularly dopamine and serotonin, these neurotransmitters in the brain that are released. And there are things that can help release those neurotransmitters more, such as being in the sunlight, physical activity, and certain foods can help increase these neurotransmitters. And would you believe even just intentionally smiling? So if you don't have a smile on your face right now, go ahead and smile. Because even a forced smile and forced laughing can get those endorphins, that dopamine and serotonin to release, and it's doing your body good. So go ahead and laugh and smile right now. And let me know if that made you feel better. Any questions, Chef AJ?
Yeah, so we have, well, I don't know, question. A lot of times it's more comments than questions. People are saying they love your beautiful website with all the photos of the vegetables. I haven't heard back from, oh, here's one. How can I come train with her?
Okay. On my website, there is a contact. They can contact me through the website. Well, I'll give it the website right now. It's www.drlynettemd.com. And my services are virtual health coaching services. And I'd love to work with them.
Right.
Alrighty.
Tammy says, plant-based eating has not helped my type 2 diabetes as I have an adrenal gland tumor. My sugars are very high, regardless of no oils, no dairy, no meat, and tons of insulin.
Mm-hmm. Yes, unfortunately, not all diets, not everything works for everyone. And so it's important for her to work with her nutritionist and see what does work for her. That's how I would respond to that.
Thank you.
Okay, so K, kidney health. Diabetes is the #1 cause of kidney failure. Early signs may be ankle swelling, increasing blood pressure levels. So if these are occurring, please make sure you follow up with your healthcare provider. Checking your blood work. You won't know what your kidney function is without labs. So that's important, getting your BMP check, basic metabolic profile, to look at your BUN and your creatinine. Those are the key things that are looked at in determining kidney function. Your GFR, which is glomerular filtration rate. Those are important things. And also checking for protein in your urine. And these should be checked at least 2 to 4 times a year, again, based on how well or how poorly control your diabetes. Yes, because if we don't want you to go on dialysis, if we can prevent that. The L is limit: dietary fats, cholesterol, salt, refined processed foods, juices, and sedentary activities. Now, when it comes to juices, now that picture that I showed at the beginning, at that time, I drank very little water. I probably didn't have any, but I drank many glasses of sugar-laden beverages. Just I remember I just kept drinking them because I was trying to satisfy my thirst. But as we know, juice, the sugar, it does not satisfy. And so I recall having like just back to back to back to back to back, 8-ounce glasses of juice with no satisfaction. And you would think that I would have known better because I was a physician, but us physicians, back when I trained a long time ago. We did get some nutrition, education, but nutrition is not the centerpiece. In most educational medical school training, nutrition and lifestyle is not the centerpiece of healthcare. But I have learned throughout the years that nutrition and lifestyle should be the centerpiece of our health. And that's what I'm on a mission to help empower and inspire persons to take charge of their health. Because I want to be in charge. I don't want the medications to be in charge of my life. How about you, Chef AJ?
Well, I love that. Nutrition and lifestyle should be the centerpiece of our health. That's beautifully said.
Thank you. All righty. So let's go on to M. Monitor your home glucose. If you don't have a machine, please get one. If your insurance doesn't cover it, go ahead and invest in one. You are worth it. Monitor your A1C, your blood pressure and cholesterol, as we discussed. And also to this medical alert identification. I think it's very important that persons with diabetes have something on them that identifies them as a person with diabetes, whether it's a medical or bracelet or necklace. I have a little card here that it says here, right here, it says, I have diabetes. I am not intoxicated. If I am unconscious or my behavior is peculiar, I may be having a reaction associated with diabetes or its treatment. So, because usually if someone, let's say, passes out, the paramedics or what have you, they may look through your wallet to see identification. And if this is with your information, your ID, then they'll say, oh, we need to give some glucose or glucagon or what have you there. So I would just recommend that persons with diabetes have medical alert identification on them.
That's great.
All right. Okay, medications. Okay, so medications, if taken, you should learn what it is treating, be aware of the potential side effects, and get lab work as advised. Now, all medications have side effects. We know that. And there has to be a balance of risk versus, benefit. But some commonly used medications may actually increase glucose levels, such as beta blockers, statins that are used for cholesterol, thiazide diuretics, which is like the HCTZ. Medications that can increase weight gain include insulin. I hear complaints, all the time as insulin levels increase, the dosages, they're gaining weight. So it's like, look, you asked me to lose weight, but insulin is making me gain weight. So it's like a catch-22. Also, some cholesterol levels may increase from certain medications like beta blockers, which are used for blood pressure control. So again, it's important to know, we're not asking you to, have the information like a pharmacist, but there's just so much information out on the internet. Go on to a credible, source to just research that medication. And I do recommend that if you are having challenges with your weight, ask your doctor, are you on weight neutral medications? Because if you're on a blood pressure medication like a beta blocker that can be weight promoting, then you may want to make it be switched to ACE inhibitor, which does not affect your weight. So there's just a little pointer there and it's okay to ask your doctor these things. If your doctor is not willing to work with you, then you may want to look for another healthcare provider. I keep saying doctor, but there are other healthcare providers besides physicians taking care of persons with diabetes. And another important thing for medications is as your lifestyle improves and you're eating healthy, you're losing weight, your dosages of medications will most likely need to be decreased. Please work with your healthcare provider to have those dosages decreased. And that's the goal, to come off these medications where possible. Let's move on to N, nutrition. We want to focus on the whole plant foods and fiber as discussed, decrease fat and cholesterol intake, avoid snacking between meals, read your food labels. If you don't know how to read your labels, please learn to and consult a nutritionist as necessary. Neuropathy, nerve damage is caused by uncontrolled glucose levels, causing painful neuropathy. It is a risk factor for amputations. And unfortunately, there are about 73,000 amputations per year, not related to trauma. And you may know someone that had a toe amputated, and then they had the foot amputated, and then they went to a below the knee, and then they went to a above the knee. It's unfortunate that this has to happen, but does it really have to happen? So hopefully this information will help empower and inspire persons to take charge of their diabetes. O's, ophthalmologists, please get your eyes checked. Diabetes is a leading cause of blindness. P, prediabetes, we've touched on this. That is before the diagnosis of diabetes. And actually, it's found that prediabetes typically has been present for many years before diabetes is actually diagnosed. And prediabetes also has increased risk factor for complications, cardiovascular complications, and can even start affecting the small blood vessels of the eye and eyes and other health conditions. And the good news is, because it's pre-diabetes, it's even more amenable to being reversed with lifestyle. So that's the good news. That's exciting. That's exciting. Q, quit smoking. Now, in doing my research, I came across this here that smoking causes diabetes, and that just stuck out. I was like, I really hadn't heard that smoking causes diabetes. Have you heard that before, Chef AJ?
Well, not particularly diabetes. I know it's not good for you, though.
Exactly. And so, I checked several sources, and this is on the CDC. So smoking causes diabetes, and it's stated that smoking makes diabetes actually more difficult to control, that those high nicotine levels can lessen the insulin effectiveness. We already know it causes, contributes to lung cancer, but also can contribute to poor blood flow to the legs, neuropathy, retinopathy, and other conditions. So let's try to quit that smoking. R is rest. Sleep is crucial for reversing diabetes. When you don't get enough sleep, there's also increased risk of cardiovascular disease. And would you believe, when it comes to weight, that lack of sleep triggers the hunger hormone, which is called ghrelin, the GHRELIN here. And lack of sleep decreases the leptin, which is the satiety, the fullness hormone. So I tell you, we talk, the importance of sleep is just so critical. Excuse me. And I know that most of us in America probably have a challenge with sleep. And you know what probably the number one thing is? And I'm guilty, is this little phone here. We are on this phone, day and night. But, we have to develop some discipline. And not to mention the blue light that comes from these phones here can impact our health. Now, other risk factors for diabetes include increasing age. We talked about the weight. Also, gestational diabetes. Women who have had large babies, also increased risk. And then also persons of African, Hispanic, Asian, Native American heritage are at increased risk also. S, okay, we are coming down the pike here. Okay, stroke awareness. Please make sure you are aware of signs of stroke. Stroke is 2 to 4 times higher in diabetics. Call 911 immediately if it is suspected, because time is critical. Time to treatment is critical. And example, there's a mnemonic called FAST: facial drooping, arm weakness, speech difficulties. If those are present, call 911. Because if we can reverse the effects of stroke, that's optimal to minimize your complications and disability afterwards. Sunlight is also critical for diabetics. It's important just because of the vitamin D. Vitamin D is so important for everything in our bodies, including the immune system. Low vitamin D levels may be associated with insulin resistance and increased diabetes risk. But let's get this sunlight in. And I know even in the midst of this pandemic, let's get outside. T, temperance, avoid everything harmful and use the good in moderation. Live a balanced life. That's very important, not just for persons with diabetes, but just all of us in general. U is understand your unique needs. You are unique, and it's just important for you to find out what works best for you in conjunction with your healthcare provider to help monitor your health. Okay. V, I have your vegetarian vegan diet, which is what I promote. Now, I mentioned that picture at the beginning. I had been a vegetarian for 10 years. All I did was just take out the meat and had everything else. And with time, I learned how to incorporate fruits, vegetables, whole grains, and which I just totally love. I get so excited when I'm able to make a big bowl of salad. I love salads so much, and I love to put the different colors in there, and just a rainbow of foods. And that heart there, you got the red, the orange, the purple, the greens. So the more colorful your plate, the more health promoting benefits you will get that each color provides. And just have fun in the kitchen exploring. Now, I like to do what's called a kitchen pharmacy makeover. And yes, I do know how to spell pharmacy, but I have this here on a play of words, pharmacy, because you want to convert your kitchen into a place that helps prevent and reverse disease. And I have my top picks here, particularly for diabetics. Fruits. The blackberries, their GI index is just 25, raspberries, 32. That is awesome because you often hear diabetics say, I can't have any fruits. Yes, you can have some fruits. It's just a matter of choosing the right one. So this is just an example of good fruits to have. Veggies, the cauliflower and the broccoli, again, very low glycemic index. And the beautiful thing about cauliflower, you can do so much with cauliflower. I like to make a cauliflower stir fry with that. And you can even make like fettuccine sauce with the cauliflower. They got the popcorn, cauliflower, chicken that they're making. Just so much you can do. But don't fry it. Okay. Maybe use the air fryer instead. You got your beans, quinoa. These, again, just examples of things to help transform your kitchen into a pharmacy. As far as your seeds and nuts, I like the flax seeds and the chia seeds. The chia seed, when I looked up the glycemic index, it said 1. I was like, what? I was like, wow. So even though they are higher in carb, because it's so much fiber in there, it just negates it. So include some chia seed, but of course discuss these additions to your diet if you're not already using them with your healthcare provider. And if your healthcare provider is unsure, then just ask for an appointment with a nutritionist. Also, spices that I just love to add in diet just for anti-inflammatory effects are turmeric and ginger. And there is a new spice that I have come across called Herb Spice Everything Savory. There's a picture down there, but that has become one of my favorite seasonings. When I make my cauliflower stir fry, I just have it's the frozen cauliflower rice, frozen mixed vegetables. I put in a little bit of Bragg's liquid aminos, just a little bit, because that can, it tastes a little bit salty if you put too much. And then I sprinkle some of this everything savory seasoning on it, and voila, it is so delicious. And the good thing about this seasoning is that it has nutritional yeast, and nutritional yeast is high in vitamin B12, and I brought the B12 out because you may not be aware, those of you who are on metformin, one of the diabetic medications, that persons on metformin may experience more of a vitamin B12 deficiency. So please make sure have your vitamin B12 levels monitored. But again, I love this new seasoning, and I just wanted to share that. Okay, W, ta-da, here we go. All righty. So the good news is, no matter how much you weigh, how much excess weight you have, that even just a 5 to 10% reduction of weight loss can improve your metabolic function, can improve glucose levels, can improve blood pressure levels, even just a 5 to 10 reduction. So that's good news, because if you are 250 pounds and you're like, man, I got to get down to 120 or what have you to have benefit. No, that's not true. Just start with working with 5%. That would be what, 12 and a half pounds? Just start small and then, increase as you go along. So here I am again, 2003, and here's another picture of me on the right. I don't know exactly what year that was, but what I'm doing actually in that picture on the right, I am actually at a church. Oh, I'm about to get some tears now. I am at a church and giving health information, because that's what I love. That was my passion, and I did that despite the size that I was, because it didn't matter. That's what I wanted to do. And the beauty is, no one ever told me, Dr. Lynette, why are you even educating people when you are so big yourself? No one ever said that. And so I would just ask, excuse me, just have AJ, I did not expect to break down, but
It's okay. Well, that's why we love you, because you're so real. And, I had a wake up call when somebody once said to me, if the vegan diet is so good, why are you so fat?
Mhm. Right. So no one ever said that. They may have thought it, but they never told me that. And so I just kept, learning and educating. And actually it's through my church that I learned so much about health. And, I was, health leader, and I just began to incorporate and absorb those things that I learned about, plant-based diet and these lifestyle factors. And also at this time in 2003 is, again, I was in this health crisis, and I felt out of control, didn't know what to do. And so a part of the rainbow pathway, the rest, activity, ingest, nature, believe, overcome, my faith was very important in the process of me beginning to have a healthier lifestyle, is that I prayed and fasted. And I was inspired at that time to develop the rainbow pathway. And here we have rest, activity, and just a rainbow of foods: nature, belief, overcome, and water. And as a result of implementing the rainbow just through time, and had ups and downs, have lost weight, gained some back, losing, so it's a journey. It's a journey. And so as a result of following the rainbow, was able to exchange premature disability and death for a more vibrant, abundant life, as I took charge of my health. And as you follow the rainbow yourself, you also can just avoid premature disability and death. And one thing I did notice, Chef AJ, is that when I fell off the rainbow, then it showed in my health. But when I got back on the rainbow, things start to move in the right direction. So, it is a journey. And I'm just so, grateful to be able to share this with our audience here. And okay, so we are at X. So what's the next letter?
Why?
Y. Okay. You can win the diabetic obstacle course race. You can control and reverse the effects of diabetes. You can take charge of your diabetes. You can overcome. And then I had to figure out, what am I going to do for Z? Here we go. Zip into a smaller size pant or skirt as you follow the rainbow to hope, healing, and transformation. And so there you have it. What you need to know about diabetes from A to Z and how to reverse it naturally too. And you learned a little bit about me. So I thank you so much for allowing me to share
Are you
this
kidding? The
present.
pleasure was all ours. People are really, they say, I love her. What a sweetheart. She's so delightful. If you'd like, Dr. Moore, take it off screen share and then we can see you a little bit
Oh,
bigger.
okay. All righty. Let's see.
Yeah. Well, the thing is now when a patient says, hey, doc, you don't know what it's like, you can say, well, let me tell you.
That's right. Okay. In my office screen share, let's see.
I know, but I'm still seeing it. So
Okay.
uh,
Uh-oh.
let's see. Maybe I can do it for you. Hold on. Let's see if I have a.
Yeah,
Um,
how do I get off screen share? I have my publicist
the,
here helping
just
me.
just go to the button screen share. There's something that will say stop screen share. It'll either be at the bottom or the top. Seeing if I can help you do that, but nope. I think it has to come from you.
Oh, okay. Okay,
Oh,
oops. No, we don't want to. We don't want that.
the little bar on the bottom that says stop screen share with the upside down with the triangle. If you click that, what happens?
You see that?
Or you can go on top where it says.
Okay. Let's see. Sorry.
And yes, guys, she's in Virginia Beach, Virginia, but she practices virtually. And if you go to YouTube, if you're watching on Facebook, you can't see show notes. Show notes are only on YouTube for some reason. That's how it works. So just go to my YouTube page and you can see all her different websites and offerings. And hopefully she'll come back.
Do you see me, Chef AJ,
I
or no?
see you, but I only see you when you talk, but I still see your slides. So if there's a way to
Okay.
stop the screen.
Alrighty. I am so sorry about this.
No, it's okay. I don't think I can control it from my side and get rid of you. I can get rid of
Okay.
you,
Let
but
me.
I don't want to get rid of you.
Okay.
Let's see, view standard.
Let me get out of this here. Okay.
You got in, you're gonna have to get out. There you go. Yay! Now we
Oh,
can
okay.
see all of you. Terrific.
Okay.
Is your family on the plant-based journey with you?
Yes. And actually, I can share how I got to be plant-based.
Sure, I'd love to hear your story.
Okay. Growing up, we had my family, we were a flesh-based family, but once in a while we would have a vegetarian meal because our church advocates a plant-based diet for the most part. But when I got to medical school and when I went into the anatomy lab and started doing dissections and looking at the muscles, it sort of reminded me of the chicken I was eating. I'm like, wow, I really never made the connection that the flesh I was eating was muscle. And so that sort of turned me off. And then that in conjunction with I was dating my husband at that time, and he was a vegetarian. He did not eat meat. And so after we got married, I no longer ate meat, and that anatomy experience helped propel that too. And again, we ate the cheese, we ate the eggs through the years, and so that was 2003. Gave up the animal products, but it was about 2008 or 9 is when we gave up the eggs and the cheese and became fully plant based. And we raised our daughter on a vegetarian diet. And she did experience, after she went off to college, she did experience with flesh, but she decided that was not for her. So she's a vegetarian. And she was actually able to, while she was at college, influence her colleagues, her student colleagues, inspired them to become plant-based.
That's neat.
Hmm.
Yeah, when you aren't raised with it, you really don't have much of a taste for it.
Hmm. Right. And the funny thing is, I can remember what the flesh tastes like. The food was just, it was so good. We have to admit, animal products do taste good. I remember,
Only if you cook them and put stuff on them.
right? The baby back ribs or the, KFC.
But that's the sugar, fat, and salt. See, what you like about the ribs is the sauce.
Right, right. So it is good, but we can retrain our taste buds to enjoy the plants that um, that just satisfy. And I remember I did a fast, and when I came off the fast, when I bit into a tomato, that tomato tasted so delicious. The beauty about our bodies is that even our taste buds regenerate. So if your taste buds are distorted because you're used to a high salt diet, if you just give it a couple of weeks, those taste buds can regenerate and you will become accustomed to a lower salt diet.
Absolutely. What's your favorite type of things to eat now?
Salad, fruits. Again, the cauliflower stir fry rice. I typically try to stick with the whole plant foods. Not that I don't use any of the mock meats, which I do use sometimes, or some processed foods. But the majority is foods from the garden because that's where the healing is.
Yeah, neat.
Mhm.
So, do you want to talk about the different programs you offer? Because I do have it in those show notes if people want to find out more about you.
Oh, okay, yes. So I offer the virtual coaching services. I provide lifestyle makeover where we look at your current lifestyle and create a plan based on your goals from the time you wake up, from the time you go to bed, to fit in the rainbow. Actually, um, the physical activity, the rest, the diet, and the diet is sort of tailored to what you are trying to achieve. So if someone has hypertension, we'll look at foods that are particularly good for that. Folks may not know that celery is good for hypertension, and we talked about some of the foods that are more optimal for diabetics. So it will be sort of tailored to their challenges. And also the kitchen makeover, again, just looking what they have currently in their kitchen and converting it to a healthier version. Also, just ask Dr. Lynette. Now, keep in mind, these are not medical consults, but are coaching. And so that's what allows me I can discuss these things across the nation. Whereas providing medical care, I'm confined to my state. So with the coaching, I'm able to expand my services and be able to educate and inspire nationwide. And I'd love to be able to serve the folks.
Well, I think you're very inspiring. Not just who you are, but just your weight loss story is very
Uh,
inspiring in itself.
Thank you. Thank
Of
you.
course. Of
Thank you
course.
so
Well,
much.
no, it's a pleasure. Sarita says, any tips? I'm getting completely off coffee, been a coffee drinker for many decades. I really appreciated how you said that coffee can raise cholesterol because so many doctors just think it's benign. And I don't think it's a good thing to have.
Exactly. Well, coffee is, I believe, is the number one product that folks are addicted to, in the world. So, but there are some alternatives out there that persons can try, such as like postum. There's something called Roma.
Dandy
Um,
blend?
what's that?
Dandy blend.
Oh, okay, okay. And also too, looking for herbal. I like to use just herbal, non-caffeinated teas to help. But I think that will probably be a good start looking for those alternatives, Roma and Postum. I don't even know if Postum is still made anymore, but also just making sure you drink plenty of water. And the thing about coffee, most folks don't realize coffee is a diuretic and dehydrates you. So if you are a diabetic, coffee is not your friend. It is not your friend. And I recommend taking measures to attempt to decrease it and ultimately come off of it.
Thank you. AK says, do we need to detox first in order to reset the palate?
No, you don't need to detox. Now, the thing as far as your body has natural built-in detox in there, and we use the term, detox. And I do have a detox program on my website, but and what that is just using whole plant foods. But you don't have to officially detox in order to reset the balance. What the palate, you would want to decrease the amount of sodium, I would say first, to get your taste buds reset, and decreasing the amount of sugar, because it's with the decreased amount of those products that when your taste buds renew, you are able to appreciate the improved taste in its fullness. So no, you don't have to do a detox, but certainly your body detoxes naturally, and increasing fruits and vegetables, that naturally also helps detox.
Nice. That's
Mhm.
great. Let's see if there's any more questions. I think you answered this, that you don't use the meat analogs much, but somebody said, "What do you think of the Beyond?" And let's see, I saw it Beyond. Yes. Rahima says, "What is your opinion on the Beyond Burger meat?"
Okay. Well, yeah, I mentioned I do use them. I try not to use them, too much. It's Those may be helpful, especially if someone is if they are totally a meat and potatoes kind of person, then it can be used as a trans. And I do remember when I first came off of flesh, that we were eating. I'm not going to name the brand, but there was only a limited amount of brands back in the day. It was like every meal we had a meat analog. Breakfast, lunch, dinner, we had a meat analog, and that's no good. And so now it may be just used, once a week, or what have you. But it's better to not rely on those, and to eventually learn to make your own. You can make some oatmeal burgers. You can make some bean, patties. And my husband, he's the actual chef in the family. He makes, a wonderful oatmeal patty. And maybe someday I could share it
Well, I
share it
was
with you.
thinking, why don't we just have your husband on the show showing how to make it?
Yeah, we can do that. I tell you, he he's the chef in the family, and people just dream about his meals. So,
I mean that sincerely. I mean, let's have him on doing a cooking demo.
oh, okay, I will
I
talk to
mean,
him about that.
if you want to be in the episode, you can, commenting on the healthfulness. One of the things, we talked so much about diabetes today, but I know that exercise is important in general, but isn't it especially important for people with diabetes?
Yes, it is. It's important to help increase the glucose uptake, particularly after they eat, and to again, exercise decreases blood pressure. It decreases, cholesterol. It just overall, exercise truly is medicine. And Chef AJ, I wanted to bring this up. When it comes to just overall weight loss, it's said that nutrition is the most important piece, and that exercise is maybe 20% of it. But would you believe that exercise becomes more important to maintaining weight loss after you've lost it? And that the amount of exercise that's required seems pretty much like almost doubles. Whereas before, they were recommending 150 minutes per week for, health maintenance and preventing weight gain. Um, but to prevent weight regain, it can go up to 300 minutes per week.
I would have normally said I did not know that, except that I'm gearing up to host the third annual Truth About Weight Loss Summit, which starts
Yes.
on Saturday. And one of the speakers is Dr. James Hill, who founded the National Weight Control Registry. And he basically said what you said, that you can lose weight any way you want, but to keep it off, what the people had in common that were able to keep it off was at least 1 hour of some significant exercise every day.
Yes, yes, yes. So, and I look forward to that weight loss summit. I'm excited about it.
Well, maybe you can be a speaker next year. Maybe you can make kind of like this kind of presentation and just talk about weight loss, because
I'd love to. I
well,
would certainly love to.
Consider this your official invitation.
Thank you, Chef AJ.
You
Thank
are
you so
so
much.
welcome. Oh, you're just wonderful. So thank you so much. It was a pleasure getting to know you a bit more.
Same here. Same here.
Yeah,
And I want to thank the audience also.
Right, and we look forward to having your husband on.
I will tell him.
No, seriously. Oh, a meat made from oats. I mean, sign me up.
Oh, okay. Yes, it is. And maybe what we could do, we can make some in advance and actually somehow, I don't know if we could ship it to you. Well, we'll just maybe share I'll see if he'll share the recipe with you, and then you can make some too.
Well, if he's going to be on the show, he kind of has to, or what you can do is you can, what some of the people that come on the show, instead of just giving it on YouTube, they ask the people to sign up for their newsletter. So they're getting their email and then they give out the recipe.
Okay. Hey, speaking of email, thank you so much for that reminder. Yes, on my homepage of my website, persons can, if they click that link there, they will sign up on my email list so they can keep abreast of the activities I'm doing. And also they will get a free gift, and that free gift is actually the Clean 15 and Dirty Dozen, a list of fruits and veggies that they'll want to purchase organic to minimize pesticide exposure. So I would certainly recommend that persons sign up on my homepage of my website. And I'll just want to give my Instagram. It's Dr. Lynnette. And I do provide education on that IG site. I'm not on Facebook too much. IG is my baby right now. I just joined social media 2 years ago. So it's been a wonderful journey. And meeting you has been part of that wonderful journey. So again, thank you so much, Chef AJ.
My pleasure. I was so glad to catch you on that summit. And thanks all of you for watching another episode of Chef AJ Live. Please come back tomorrow when we actually have a doctor doing a cooking demo, Dr. Nate Gershfeld. We couldn't quite fit him in this year for the Truth About Weight Loss Summit. So as a preview to Saturday's summit, he's coming on tomorrow and he's going to make some delicious food. Thanks again, Dr. Moore. Take care.
Okay, thank you.
Bye-bye.